Okay, can you see us back on the screen?
You're still sure.
Okay. There we go.
Okay, well, thank you, Kelly, for that. And again, if anyone has questions or comments, please put those into the chat so that we can address them. So this is a listening session, so I don't want to talk too much, but I do want to provide a bit of background before we get started. A link to a document has been put into the chat for your convenience. The document is a framework or is the framework that outlines how the feasibility study is being conducted and provides additional information. First and foremost, I want to make sure everyone knows no decisions have been made. I am collecting data in order to make a recommendation to the Board of Health. I anticipate presenting that recommendation at the September Board of Health meeting. The decision that they will be making at that point is whether to move forward to step 2. Excuse me. The purpose of the first step of the feasibility study is to figure out if separating treatment services from SRHD is a good idea. Would it be in the public's best interest to separate? Some of you might be thinking, why would we consider such a thing since the opioid crisis is so bad in Spokane County? And why we're conducting this feasibility study now is in part because of the urgency of the situation. The treatment services program at SRHD is the singular largest opioid treatment program in Washington state. We serve approximately 1,000 clients who are actively enrolled in our program. But is that enough? Anecdotally, we know we are turning away at least 5 people a week who want to be assessed for admission into our program. If we were to separate from SRHD, would the new organization be able to move quickly and expand services to meet the increased need? As a governmental agency, we are bound by governmental processes and we can't move quickly. Plus, our focus has to be on being wise stewards of taxpayer dollars. And last year, treatment services ended the year needing to be supplemented by the general fund, which is taxpayer dollars. This hasn't happened very often, but it is a concern. Do the public health benefits of having treatment services under SRHD outweigh the cost to the taxpayer? There are some very public healthy things that we do at our treatment services program. Would an outside organization be able to continue these client-focused services? We don't know. These are examples of a few of the questions that are being grappled with in the first part of this study. I encourage you to read that framework that's in the chat for more information. And our hope this morning is to hear from you about your thoughts on the possibilities of treatment services separating from SRHD. We have held 8 listening sessions with SRHD employees that were very informative and helpful. We now want to hear from community members. And as Kelly had indicated, we are taking your questions and comments through the chat function of Zoom. And the how-to for doing that has been posted in the chat, just to help you if you need a reminder or you joined us after her presentation. And we will take your questions and comments in the order that they're received. And questions that don't align with the feasibility study will be shared with me after this town hall. So with that, let's get started. And Kelly's going to share the screen again. And we're just providing these questions to consider as examples of what we're hoping to hear from you today. So what concerns do you have about the potential of treatment services separating from SRHD? What do you want to make sure is addressed as data is being collected? And are there potential benefits that you can see of treatment services being run by a private business rather than a governmental entity? And do you have thoughts on the potential impact of a private company running treatment services regarding access to care, treatment quality, and community needs? And is there anything else you want us to know as we move forward with the feasibility study? And so with that, do we have any questions in the chat?
Not quite yet. No, no.
No?
But we did add these to the chat. So if we go
Yeah.
back and forth,
Okay.
then people can
Okay.
see them.
Okay, so we're going to stop the share and come
Mhm.
back. Also, if you would prefer to speak, let us know by raising your hand and we can unmute your microphone. We will ask you to also go on video if you choose to speak. And this is a town hall, so we could, Kelly and I could also just start talking about the process so far, and some of the things that I've heard in the listening sessions from employees. I failed to mention that I've had one listening session with WSU researchers as well. And we have more listening sessions scheduled that Better Health Together is helping us to organize and facilitate, and the dates haven't been set for those. So that will be announced just as soon as we know the dates for them. But some of the things, I mentioned public healthy. So some of the things that we do that are perceived to be very different from other opioid treatment programs is we really wrap our clients around with other services. We connect them to resources in the community that they might otherwise not know about. We have a program that is targeted to pregnant women who are wanting treatment for addiction. And we're able to connect them with our programs like WIC and Nurse Family Partnership and other organizations within our community that can help them not only, we're not only concerned about helping them to overcome their addiction, we're also concerned about helping them to be successful parents. And we really go out of our way to help them get wrapped around with services. And one employee was sharing with me that we have a client that's been with us for a while now. And when she came to us, she was pregnant. And in hindsight, she was sharing with the counselor that she really didn't understand what we were doing at the time, because she was just in that recovery phase of really focusing on her addiction, but at the same time, we were connecting her to other services. And looking back, she can see how our program just really enveloped her with opportunities to be successful, not only in her recovery, but in life and in parenthood. And that was really cool to hear that story. We also have a special focus on veterans. We take the special veterans insurance that they have, and I'm told that others don't. And I want to be clear that I've really been focusing on listening to employees. Now I'm focusing on listening to community members and external stakeholders. And I'm just at the very beginning stages of listening to other opioid treatment programs and other entities that might be interested in taking on treatment services if the Board of Health decides to go through step 2 and then step 3, which would then lead to an RFQ process. And so everything that I'm sharing is what I've heard, but I have not yet talked to other opioid treatment programs. So I want to just be clear about that because I haven't talked to them yet. I don't know from their perspective what they can offer. Another thing that we do that I'm not sure if other OTPs do, but we have a sliding fee scale. We have a kind of a hardship payment program where we work with our clients really, really diligently to help them stay on the program. It is a fee-for-service program. The program is supposed to be covered through the fees for the services. We take all insurances, we take Medicare, we take Medicaid, and we have private pay individuals, and we have individuals on the sliding fee scale and also on that hardship program that helps them to stay on the program when they might be in a phase of being unemployed or having a significant life issue that's challenging them with their finances. And it's my understanding we have not had to dismiss a single client for lack of ability to pay in over 5 years. And that is kudos to our team, our finance team at Treatment Services, because they really work diligently with the clients to help them be successful and stay on program. So these are things that, and there's a lot more, but these are things that we want to make sure if we were to separate that would continue with whoever was successful in applying to take on the treatment services program. The other thing that has been shared with me by clients and by the researchers that come in and help to grow the knowledge around what are best practices for opioid addiction recovery is that our treatment services program has a culture of just being welcoming and respectful and honoring the individuals that we serve as people, as individuals. And it's a no shame kind of atmosphere. We know the clients by name. And it's almost like one of the researchers stated that it has almost like a family feel that because, one of the things about a medication assisted treatment program is that it's a harm reduction approach to addiction, which means that it's like if addiction is a chronic disease. And if a person has a chronic disease of any other type, they're never expected to just go off their medication and kind of get over their chronic disease. And so with opioid addiction, some people are able to get off of the assisted medication like methadone. And there's another medicine that I have a really hard time pronouncing the
Misty could
name. Yeah,
pull that
Misty
out.
can pronounce it. Misty, do you want to jump on and say what that other medication that we offer is?
Buprenorphine.
Thank you. Um, and but for the most part, it's like there are many of our clients that have been on our program for many years. They're leading very successful lives, and it's a harm reduction model. So Kelly, have we gotten any questions or
Well, one question,
comments?
and you're kind of starting to answer that already,
Okay.
because it was just what have we heard? What have we
Mm-hmm.
heard so far from our earlier session or from the sessions that you're having with employees? And I think one thing, you're saying all these wonderful things about our program. So I think the biggest thing that we heard yesterday was concern over how those things are going to continue for the
Exactly.
community, for our patients and clients, for the employees that are working in that culture that you
Mhm.
just described.
Mhm.
So
Mhm.
I don't know if you want to address some of the concerns that we heard yesterday, and the things that we're doing to try and through the feasibility study to address those and to ensure that those are taken,
Right.
the needs are taken care of.
Absolutely.
Mhm.
Yes, I can, because it's like yesterday, one of the concerns that was mentioned by attendees was a perception that private opioid treatment programs are really focused on the numbers and seeing a lot of patients so that they, if they're for profit, by nature, a for profit is for profit. And so the more patients that they would see, the more profit they would make. Um, and so again, I want to make sure everyone understands that right now I'm just taking information from employees, community stakeholders, and the community members. And I haven't talked to actual OTPs yet about their programming. And so that I'll know more after I move into that phase. But some of the concerns that have been shared with me by both clients, because I've been talking with clients too, um, and employees, is that when they've worked at other OTPs that were private OTPs, that they had really high caseloads, and the clients stated that they felt like they were just a number and kind of being herded through the process rather than receiving the really intentional, focused, patient-centered care type of wraparound services that we have at SRHD. Some of the WSU researchers also indicated that they've had challenges when they've been trying to work with some of the OTPs, the opioid treatment programs that they had hoped to work with. Um, and I'm going to just be transparent that that's one advantage of government. We have to be transparent. We don't get to hide things, right?
Mhm.
And so one researcher shared that they had done a research study with a private OTP, no idea which one, where it was located, or any of those specifics, but the outcomes were not complementary to the OTP. And so they pulled the data sharing agreement, and the researchers were not allowed to publish that data. And so consequently, that body of knowledge from that research project was never shown or never shared with the larger community that addresses opioid addiction. And it also negatively impacted that researcher's career trajectory
Hmm.
for tenure.
Hmm.
And so that was a really negative experience that they had had
Hmm.
with a private OTP. So, do we have any questions or comments?
No,
No?
that's the only one so far.
Is there anyone that wants to speak that, we didn't actually show you how to raise your hand.
Yeah,
So,
because we were supposed to be chat.
but if there is anyone that wants to speak, I would love to hear your comments and if you have any other questions. I do. I'm trying to figure out how to do this. So I know there's one individual that's on this particular town hall who might have some background information for us on how did how did it turn out that Spokane Regional Health District and the Tacoma Pierce City County Health Department are the only two health departments in Washington State that have opioid treatment programs. We know our program here started in 1990, and it was basically started because of the heroin problem that we had in Spokane. I personally had a classmate who overdosed from heroin and passed away. Um, and I was really thankful when I learned that that SRHD had started an opioid treatment program for methadone in 1990. But we did it because there was no one else in the community who had done it or was doing it. And so that's typically what public health does, is if there's no one else in the community, we step up and we provide the care, the needed care. And I wasn't working in public, I didn't start working in public health until 1999. So if there's anyone on the call that has some historical knowledge and background of like the why, the original why, and I would love to hear that as well.
Okay. And our moderator said that she's just let her know if you want to unmute.
Yeah, exactly. Basically in the chat, if you want to be unmuted, just let the chat
Moderator.
moderator know, and we'll be happy to do that. Let's see, some of the other questions and comments that came up in yesterday's town hall were about the whole issue of foundational public health services. And so Washington State has adopted the foundational public health services model to the point where our legislature has actually passed law that now funds foundational public health services. And we don't have that link to the Washington State there's a PDF document that outlines and talks about all of the foundational public health services that are funded through that legislation. But a direct healthcare service like the opioid treatment program is not what is considered a core foundational public health services. But there is a caveat to that local health jurisdictions like ours, we can state and incorporate a program that does provide direct services if it makes sense for our community to say, for our community, this is a core foundational public health service that we feel our community needs to have. And so, part of this process is just really looking at all the public healthy things that we do in our treatment services program and finding out, is it possible for another organization to provide the wraparound services, the access to care to not just certain populations, but the whole population like we do. Um, Mental health is also a real issue for a lot of people are struggling with mental health issues. And that's another thing that we really work with our clients that are struggling both with addiction and with mental health concerns. And we have a mental health treatment program within treatment services, and we've been trying to grow that program. And so similar to a lack of uh, finances to pay for their services, we also don't discharge clients if they have a serious mental illness, for example. We really work with the clients to help them to work through some of their mental health issues and help them to learn their coping strategies so that they can be successful on the program with both addiction and their mental health concerns. And so it's really a matter of is there anyone else out there that might be able to do what we're doing better and to be able to grow the services more rapidly? One of the things I talked about yesterday is that the way it works in like in within a governmental entity is that you have to have the money to be able to move forward with filling positions, for example. Um, and in business, you do a pro forma and you figure out, you know, this is how many encounters we would need to cover the cost of bringing on these additional employees. And you, based on the pro forma, you move forward and you go ahead and hire those employees, knowing that eventually the increased number of encounters is going to cover the costs. But we can't do that in government. We have to be extremely wise stewards of the taxpayer dollars and ensure that we're following what our community wants, how our community wants us to spend those dollars. So, and we follow the foundational public health services.
Which we added to the chat. So that
Oh,
document
good.
on
Thank
DOH is
you.
on there. But I
Thank
think
you.
another point that you made that, find if we were to move forward, if there was another entity that we felt could meet the needs of the community and our employees and our patients, that doesn't mean we aren't still a partner. And we
Oh,
continue to
right.
be a partner with a lot of other organizations in the community where we're able to offer those wraparound services. So, there's a
Right.
lot of healthcare services out there that we don't provide ourselves, but we're still working with those healthcare entities
Absolutely.
to, for them to refer to us for, nurse,
Everything.
for
Yeah,
our
that we do.
different
Mhm.
programs for families and,
Right.
or for treatment services or
Mhm.
other
Mhm.
things that we offer. So,
Right, right.
mhm,
Exactly, exactly. So it's a big question, and it's a question, this question about is it the right time for treatment services to separate from SRHD? Basically, is the organizational structure holding them back from being able to expand and grow and be able to provide more services? That's what the question is, truly. Um, and it's a big question, but it hasn't just started today. it's a question that has come up repeatedly over the life course of our opioid treatment program at SRHD. But due to the current crisis, now was the time that we really needed to look at, would our treatment services be better off and be able to be more responsive to the community need outside of governmental structure? So I would love to hear your comments, your thoughts, and your questions. A lot of what's happening right now for me is I'm just collecting feedback from everyone. And that's how I'll end up making the recommendation to the Board of Health. And so if anyone has comments or questions, please put them in the chat or ask to be unmuted. I'd really appreciate it. Okay.
Yeah, I'm not seeing any more questions. Is there a bottom line or a closing statement that you
Well,
want to make sure everybody kind of leaves with?
Sure. Again, it's the number one is that right now no decisions have been made. I'm collecting data. I'm collecting data from as much of our community as is willing to participate and provide feedback. So again, if you weren't comfortable sharing that on this call, please send an email to the email address that was given in the slides. And if our chat moderator could go ahead and put that email address in the chat again, I'd appreciate it. But it's really important to know that this is a iterative process, meaning that at the September Board of Health meeting, which is always the last Thursday of the month, except August and November. We don't have a Board of Health meeting in August, and our November and December Board of Health meetings are combined. And so it's usually earlier. I can't remember if it's the first or the second Thursday of December. But the first decision that they will make in September is whether or not to have me move to step 2 of this feasibility study process. And all of that is outlined in the framework that you have a link to in the chat. And so the second step, if they decide to move forward to the second step, is really getting into all the details of what would it really take to separate treatment services from SRHD, all the details of contracts and data sharing agreements and all of those details. And then and that's when all the attorneys and the accountants and everybody gets involved in the legal aspects of it. And then if after that process, the recommendation is to go ahead and take the next step, that would be to step 3. And that would be really looking at, okay, if we're going to do this, how are we going to develop the RFQ process? How are we going to determine which interested party would be selected to take on treatment services? And that process would include all of these things that we know about our program and wanting to ensure that access to care is continued to be for all individuals who are wanting to access the care that we provide and all those other details. So it's not going to be fast. If we go beyond step 1, right now, I haven't focused on step 2 because there's no reason to. And I don't know how long that would take. Step 3, I haven't even, that's even further out in my, so.
Well, thank you for sharing that. And
Mhm.
again, the link to that whole framework is in the
Mhm.
chat and it's on our website. So you can see those steps in detail and review them again. But yeah, we definitely appreciate you getting up this morning early
Yes.
and joining us and taking the time to listen. And if you're thinking and you do have some comments that you didn't share or a question that you have later on, that email was shared in the chat, communications_web@srhd.org. So please feel free to send those to us at any time. And Alicia or a member of our leadership team will get back to you with those answers. So again, thank you and have a wonderful day.
Thank you all.